Hello all. Welcome to my PSA presentation on women's healthcare disparities for East Tennessee State University. This is Malia Miller, and today we're going to talk about a surprising disparity in women's health: breast cancer. Breast cancer disparities in African American women and non-white Latinas still exist. Be a culturally sensitive provider. Be knowledgeable. Let's break the barriers and bridge the gaps in knowledge. Let's try to cross the divide in this culturally diverse and vulnerable population and try to save lives. Breast cancer is the second leading cause of death in middle-aged women in the United States, with a global incidence of 1 in 10 women. While African American and Latino women have a lower incidence of breast cancer than Caucasians, they have a significantly higher mortality rate. Women of color are more often diagnosed with triple-negative breast cancers. This is owing in part to a significantly higher genetic predisposition than their Caucasian counterparts. Studies also show that African American women are breastfeeding at lower rates than other populations. And as studies also show, breastfeeding has a protective factor against breast cancer. So we need to include this in our ladies who have just had babies, who may be pregnant, who are thinking about getting pregnant, and encourage breastfeeding. Many minorities may not be aware of the availability of cost-effective or free mammograms, as evidenced by a lesser number of utilization in this population for these services. There may be concerns about the cost of care, the cost of diagnostics, the cost of treatment. Minority women are often diagnosed at later stages of disease, contributing to poor prognosis and poor outcomes in these populations. The American Cancer Society recommends that all women begin having mammograms by age 45. Let's talk about breast exams and mammograms. Clinical breast exams have not proven to be beneficial in the prevention of breast cancer, in the discovery of breast cancer, so they're no longer clinically indicated to be routinely done. Let's educate women on self-awareness. That is the new standard. To be aware of their own breasts. Studies show that they'll be more likely to find an abnormality before a provider that they see only occasionally or only yearly for an annual physical, or they may not have seen one in years. So educate the women to know their breasts and what to look for. Partner with the women, make the decisions for mammograms together. The guidelines vary among reliable sources somewhat, but all agree that the target age is in the middle age years. Education and awareness is key. Empower your patients, share your knowledge. Let's not forget this vulnerable population. Be culturally aware and culturally sensitive, and share your knowledge and share the care. Thank you for watching.